Appreciate everyone coming. It's always fun to present, and I get excited about this because I get the opportunity to talk about the clinical things that I see on a regular basis. I want to talk today about this concept of inflammation in the brain. And I often use the term neuroinflammation. But when I say neuroinflammation, people's eyes fog over. They don't really know what that means. And they're like, I don't get it. You mean a headache or a migraine? And the answer is no, I don't mean a headache or a migraine. So my whole discussion today is going to be on neuroinflammation, and I want to open it up for some questions. And in order to do this, I have to talk about the function of the brain before we can talk about what happens when the brain gets inflamed. Okay. In my world, I think of the brain as like 20 different organs that are just really beautifully coordinated and working together. And most of my clients or my patients view the brain as one organ. I just have a brain and it makes me think. And they don't necessarily view the brain in the same regard. So my goal of this first introduction is to help you view the brain as several different organs that are integrated together in this big ball of nerves, and it makes you who you are. And the way I do this is through this graphic. Okay, this is a graphic that I took from a continuing ed that I went to, just the picture, and then I went in and added the language and the words. Because the front part of your brain, so if you can see me on the screen, this where your forehead is, and then just back maybe an inch or two, this is called the frontal lobe of your brain, and it's the thinking part of your brain. I like to call it the executive center or the CEO. So it does all of your decision making and thought processes. So this is how we plan, it's how we organize, it's how we think through details. It's all the complexities that really we think of in terms of our brain. We're often referring to just the frontal lobe. And I say that cautiously because nothing is just the frontal lobe. The frontal lobe coordinates everything else that's going on in the body. But for the simplistic purposes of recognizing what your CEO is, that's the frontal lobe of the brain. Okay. It's also your personality. And so when someone has a head injury and they damage the frontal part of their brain, you'll often hear people report, "Oh, when my dad had his brain injury, his personality was forever changed. He was just a different guy." Or we talk a lot about football players that in the early stages of their career, they're happy-go-lucky. At the end of their careers, they're just mean and grumpy and irritable. And there's a part that their thinking part of their brain became damaged. And this makes clear sense if I say, let's take an NFL football player who gets banged up all the time. They haven't lost their sense of hearing. That's a different part of the brain. They haven't lost their vision. That's a different part. They could still have 20/20 vision and completely lose the frontal lobe of their brain. They may not have lost their ability to coordinate things or their fine motor coordination. Maybe they have perfect balance, but from a personality standpoint, you can't stand to be with them because the frontal part of the brain has been damaged. I did a social media post not that long ago, and it's kind of funny. I thought it was just kind of a cheesy post, but it's got almost 400,000 views. And it's because it resonated with people. And the story that I told is I took my family to a university volleyball game. And number one, it was not a good game. The university in our local city lost 3 games in a row, and they lost each game badly. So trust me, this was not a nail biter. Number two, I recognize decorum when I go to a sporting event. And so we're careful about that. We were sitting on the end of a row. We weren't sitting in the middle. We were the only 5 seats on the very end, but my 2 daughters were the 4th and 5th seat. And my daughter said, "Dad, I got to go to the bathroom. I got to go to the bathroom," right? Little Daisy, you've heard her. She comes in here and asks me for chocolate milk every 5 minutes. So when she starts telling me, "I got to go to the bathroom," you got to move. And then my other daughter said, "Dad, I'll take her, but can I go get some popcorn?" And so I was like, "Yeah, hold on a second. Let's just wait till the next dead ball." So they play, there's a dead ball. My 2 girls stand up, and then I kind of scoot back and they walk out. And I'm telling you 15, 20 seconds max. And the two older guys behind me completely lost their mind. They start cussing and yelling because we're in their way. I mean, this was as if it was the end of the world. And my wife just kind of leaned up and said, I'm so sorry. We're just, and the guy just unloads on her. And I listened, but I didn't say anything. And after my wife leans over and she says, frontal temporal dementia. And I just started laughing. It was hilarious to me because my wife, we've lived together for a long time. We've talked about this. My wife knows when this part of the brain becomes broken, you lose your personality, you lose your social filter, you get super grumpy and irritable. And that's the frontal lobe. That's the point of my discussion today. That's a different part of the brain. So now shifting away from that, I want you to think of your speech center. There's actually two parts of this. There's a speech center where you produce speech, and then there's a language center where you kind of receive speech so that you guys are all listening and receiving spoken word and speech and understanding it a certain way. That's a different part of the brain that you're using than the part that I'm using to talk to you. The temporal lobe right down here is where we talk about dementia sets in and it deteriorates this lobe where we lose our memory because this is where memory is consolidated. There's also a tie into our emotions. The emotional center has to do a lot with the temporal lobe. And often we talk just about Alzheimer's dementia in the classical sense as this lower part of the brain. Well, how about an individual that gets Parkinson's disease? I know a lot of people that have Parkinson's disease and their memory is okay, but their motor function is in big trouble. They're tremoring. That's this oftentimes down here in the cerebellum and in the brainstem. That's the coordination center of the brain. It's where we coordinate all of our gross and fine motor movements. It's also our posture and our balance. So if you look at someone who has Parkinson's disease, their shoulders are often thrust forward and they lean forward and they kind of shuffle as they waddle around, not to be disrespectful, but the gait is very clear. That gait is related to a degeneration of that part of the brain, that cerebellar brainstem coordinating center. And then just to not belabor the point, but to talk about these, there's a sensory and a motor function center. So you got a part of your brain that just manages your sensory. I recently did a telemedicine call with an individual, and his main complaint, he said, Randy, I feel like my body is vibrating 24/7. It's like I got a cell phone on vibrating mode in my leg and in my ankle and in my hip. It drives me crazy. I can't sleep at night. Sometimes it's actually a little bit painful. And I thought, oh, that's pretty fascinating. That's probably somewhere between the sensory cortex of the brain and the motor center of the brain, right? So these are the things that I think of when I'm thinking of brain health. Well, to go on with this, most of the people that we see come to us because it's frontal lobe or temporal lobe degeneration. And the common complaints are brain fog or mental fatigue. I was with a client out of Florida last week, and this client is very, very smart. IQ is brilliant. He's just, I'm not going to tell you a lot about him to protect his identity, but he's just really smart. And I had him do some exercises with his eyes. And we did the exercises with his eyes, and he, within 4 or 5 seconds max of doing the exercises, he said, oh, that makes me lightheaded. I'm getting dizzy. I can't do that. I got to stop. Within 10 minutes, he said, actually, I think I'm getting a migraine now. Within a few minutes, he said, I can't believe how tired I am. You make me feel like I didn't even sleep last night because I just got this fatigue like crazy. And it was all because I had him do some exercises on a certain part of his brain, and we instantly induced those symptoms. Then I knew this dude has a massive inflammatory response going on in his brain. That's what I mean by neuroinflammation. So if you look down now at the bottom of the screen, the location of the inflammation in the brain is probably the greatest predictor of the symptoms that you're having. So when I say to someone, well, there's probably some neuroinflammation there, they say, well, what is neuroinflammation? Neuroinflammation predicts that you're going to have some untoward symptoms because that part of the coordinating center of the brain has become inflamed or starved of oxygen. Maybe it's ischemic. It might not have very good blood flow. Maybe it has a hormone deficiency associated with it, whatever it may be. Okay, so that's the point of this discussion. So now I'm going to jump to another slide. All right, so when we talk about neurological symptoms, we talked about parts of the brain, and I wanted to do that so that you had a concept of when I said the brain is inflamed, now you know what I'm talking about. So now let's just talk about the symptoms. So some people will have slowed nerve impulse or slowed conduction. How do we know if they have slowed conduction? It's a processing speed thing. So when you do CNS vital sign testing, the test that we do is we have you hit the keyboard ding, 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 many times, and we're kind of testing how quickly that nerve transmission can go from your brain to your motor function and hit it. Sometimes we talk about this from a speech perspective, right? If you have very slowed speech, you've got a processing speed issue. Sometimes people will say, God, I just can't think. I'm foggy. That's kind of a processing speed. It may be something else, but I'm trying to give you lots of analogies so you can think of that. Loss of speech is one. Think of an individual who has a stroke. Oftentimes people have a stroke and they lose their ability to speak. That's because that injury happened in that part of the brain. Visual changes are another one. Oftentimes people will say, well, I get floaters or I get very light sensitive. We know that with a concussion, people can't go outside without wearing sunglasses because they're so photophobic or photosensitive. That's another one. Maybe people have ringing in their ears or hearing loss. I was at church recently and someone said, oh my gosh, my whole life has changed because I've got sensory neurohearing loss. And it was, the doctor has no idea why it happened. I woke up one morning and the hearing in my ear was gone. And now there's this ringing. And he went and saw an audiologist, and he went to an ENT specialist. He did a course of steroids. He did a course of antiviral medication. Guess what? No changes. It's impaired. And I said to him, hey, I think there's some other things that we can do. And he's like, well, does the research support that? And I'm like, yeah, absolutely. The research does support that. They're not pharmaceutical interventions. Well, what could it be? I said, you could have had a stroke in that part of your. You could have had an ischemic episode. Maybe you had a viral infection and it's kind of like COVID long hauler syndrome. Everyone's familiar with long hauler syndrome. You talk about long haulers and the whole world knows what you're talking about. Well, how is it that a person could lose their hearing in one side of their ear? And we question, could it actually be a viral infection? Now you just got persistent symptoms that last forever? The answer is absolutely. So you would employ many of the same principles that we talk about in the enhanced protocol to try to address that issue with tinnitus or ringing in the ears. Now, one of the truisms of tinnitus is you have a window. You have a window of time of which you can effectuate some serious benefit. And if you don't do that, that nerve might permanently be damaged. So I told this guy, don't delay, get on that, get busy. There's some things that we could do. Depression and anxiety and mental health. I don't think the mental health in this country has ever been worse. And I'm speaking globally, right? Like I'm the most localized guy in the world. I live in this small town of Idaho and my influence is nil on the global perspective. But I have been amazed at how many people have reached out to me on social media or friends or family. And it just seems like the suicide rate is very high. The hospital rates for mental health are very, very high. It just seems more complex now than it's ever been. And I have this belief that mental health is first a neuroinflammatory disorder and second, a chemical imbalance, right? The term chemical imbalance was introduced by the pharmaceutical industry, and that myth has been debunked. Even the pharmaceutical specialists that developed Prozac have said, you know, that's really not what's happening. It's kind of what's talked about, but the reality is when there's an inflammatory response in the brain, you don't make serotonin very well. When there's an inflammatory response, you don't make norepinephrine and dopamine very well. So in that regard, is it a chemical imbalance? I guess you could say that. It's a bad description. It's a neuroinflammatory disorder. And that neuroinflammatory disorder is frontal lobe related. The next thing, PTSD. ADHD. I gave a lecture to the Nurse Practitioner Continuing Ed Conference last year, and my whole topic was ADHD alone. The reason is I'm working urgent care, I don't know, one holiday to cover for somebody who is gone. And whenever I work urgent care, my general rule is someone comes in and the nurse rooms them. And while she's rooming them, I pull them up in the system and I look at what medicines are they currently taking and what's their past medical history so I can get some context. I could not believe how many people required attention deficit medicine. Out of a day of seeing 45 people, I bet you 20 of them were on ADD medicines. And I'm not judgmental about that. I'm not suggesting to you I think that's bad or they shouldn't do that or I'm shaming. What I'm suggesting to you is that's evidence there's an underlying problem in the brain if people need ADD medicines. And many of them, I asked them, so tell me about your ADHD. And they say, oh, you know what? It was just really weird. I graduated with my master's degree, did well in school, got great grades, and I'm an accountant. And all of a sudden, I just have the hardest time slogging through a spreadsheet in QuickBooks. So I just found medicine's really helpful. And I thought, well, that's pretty fascinating. Processing speeds declined. The attention has shifted. Maybe the CEO's struggling, right? These are the things that are going through my brain. Agitation and irritability. Julie is on our call today, and Julie is the executive director of an assisted living center. And Julie is very clear. She knows that she can have a resident in that assisted living center wake up in the morning, and when they wake up, they're a different person. They're angry, they're mean, they're irritable, they punch, they scratch, they kick, they bite someone, and Julie's staff instantly, the CNA say, oh, they must have a UTI. And Julie's like, oh yeah, well, let's get a urine sample. Now, how is it that a urinary tract infection down low, below the waist, is causing the brain to become inflamed? I'm going to talk about that here in just 1 second. Coordination imbalance and neurodegenerative disease, okay? So now you understand the concept behind, I've talked about the brain, and now I've talked about symptoms. So I'm going to shift for just a little bit and talk about a couple of more things. The brain has two primary functions with all of these. It has a motor function, so we make parts of the body move, or we just call it a motor function. And then there's kind of a sensory or a thinking function. And then beyond that, I think this is where brain fog comes from. So these are just opinion statements of how I'm trying to take complex medical concepts and put them together in a presentation so that when you say, I've got a symptom going on neurologically, that you think from that neurological perspective, what's inflamed and what's driving that infection, okay? All right, I'm going to jump to the next slide. The next slide is Dr. Bredesen, who's an absolute expert in dementia, neurologist from UCLA and UCSF. He came up with this equation that the first time I heard it, I thought it's too simplistic. The next time I heard it, I thought, oh, there's something to that. The more I kind of contemplated it and dug into it, the more I thought, dang, that is spot on. This guy is brilliant. He talks about neuroinflammation over energy production. So he says, anytime you have something dysfunctional in your brain, the first thing you have to think of is it's inflamed and what is causing the inflammation. The second thing you have to think of is how do I get more energy to that part of my brain? Because that's how you're going to overcome the inflammation. Inflammation is, let's say that you've got a driveway that is crystal clear and it snows, and the snow represents inflammation. If I want to clear the snow off the driveway, I have to shovel it. If I have to shovel that takes a lot of energy to do that. So it's probably a bad analogy, but it gives you the concept that you've got to get energy to that part of the brain in order to clear the inflammation. So let's talk about that. Inflammation, you can think of, is an activated immune system. So if the brain is primarily immune system cells, when it gets inflamed, those immune system cells have become activated. And so your next question is, what caused that to be activated? So Julie's residents who have a urinary tract infection down in the bladder, That inflammation from the bladder is transmitted up into the brain and causes that inflammatory response. It's not just COVID, right? We all know that COVID long haulers can cause a lot of neurological symptoms, but the fascinating thing is COVID's primarily a pulmonary disease. It's a respiratory illness, but it gets into the brain just like a UTI can. The next part of that is energy production is ATP. Now, if you don't do a lot of biochemistry, sometimes you might think, well, what's ATP? It's just basically the energy unit of the brain. It's how your brain gets energy. And then ATP is made from blood flow because blood flow delivers oxygen and sugar or nutrients. And we often talk about ketones, right? Ketones could be another unit of currency or for ATP in the brain. So you think of, I got blood sugar or I got blood ketones. Now I have to have blood flow and oxygen to produce energy. So now it's starting to come to fruition. We're saying, okay, I get it. So let's go through all of these different elements again. These are the symptoms. If an individual, like I told you the story about the guy that I had him do some exercises, and here's the exercises. I had him put his hands out in front of his body with his thumbs up. And then I'm going to get close to my camera so you can see me. And I had him move his eyes back and forth. All he did is look at his thumbs back and forth, go back and forth. So his eyes are going bing, 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 bing. And within 5 seconds, instantly he got dizzy, lightheaded. Few minutes later, he's starting to feel a migraine coming on. A few minutes later, he wants to take a nap because he's completely exhausted. What happens is somewhere along that line, there's an inflammatory response going on. And when he does 3 repetitions of moving his eyes, he's expended all of the energy capable to those neurons. There's no more ATP. It's gone. The gas tank is completely empty. And so we've got to get energy to that area. Eric had a follow-up conversation with him because in part of my discussion, I said, listen, there's an energy deficit. Let's have you take some exogenous ketones. I want you to drink some ketone drinks and let's see if that helps. Now, I did not say to him, drink the ketone drinks when you're doing your eye exercises. I should have said that. I didn't say that. But in the follow-up call, the call was, I don't notice anything when I drink those ketones, except for the fact I can do my eye exercises with a lot more ease. It's so much easier to do the exercises. And I thought, oh, that's awesome. So that proves this is validation of this model that Dr. Bredesen has said, that he's completely utilized the energy for that particular part of his brain when he's doing that exercise. And then when he does the ketones, he now has ancillary or extra energy to be able to keep doing them, okay? The second part of this is the treatment long-term is whatever part of the brain is dysfunctional or broken or symptomatic, you have to engage that part of your brain over and over and over, because by doing that, you'll gas the energy, you'll drive blood flow to it, you'll deliver more oxygen, and then your ability to overcome the deficit goes up. So I'm going to use an analogy that everyone knows. If my biceps are weak, I'm not going to run on a treadmill because that wouldn't do anything for my biceps. It would be exercising a completely different body system and a completely different group of muscles. If I want my biceps to get stronger, I have to exercise the bicep. The exact same thing goes for the brain. If there is a part of the brain that is particularly fatigued or broken or inflamed or exquisitely symptomatic, you get these symptoms every time you do something, then whatever it is that you do that gives you the symptom is the exercise you should do repetitively. You should just consistently do that exercise over and over and over. And in my telephone call, when I explained this, the client said, dude, I did that for 5 seconds and I got lightheaded. And you had me keep doing a couple different exercises and now I got a migraine. I'm not doing that every day. It would make me sick. I wouldn't even be able to go to work. And I said, okay, so the first day you do it, you do 1 exercise and you do it for 4 seconds and you stop. And the very inkling that the symptoms coming on, stop the exercise and recover. Because you don't want to take it to failure. If I go back to my bicep, If I start exercising my bicep and on the very first day I do 550 bicep curls, I'll never move my arm again. I'll completely exhaust it and waste it and tear all the muscles and I'll be injured. But if I want to strengthen that bicep, I use low weight and I do a number of repetitions until I feel it's kind of getting tired and then I stop. And then I might have to wait a day or two and then I go back and do it again. And then pretty soon I realize, God, I can actually add 5 additional pounds and do 3 additional reps. And as I keep doing that, the fascinating thing is in the bicep, does everyone on this call know what a pump is? So a bodybuilder that's lifting weights, the more they isolate a muscle group and lift those weights, the more blood flow they get to that tissue. And that muscle becomes taut. It becomes tight and a little bit swole, and the veins start popping out a little bit, and it gets kind of puffed up. The bodybuilders call that a pump, right? So they walk around the gym and they're all pumped up because they've been lifting weights and they're engorged with this blood. The exact same thing happens neurologically. So if you challenge the part of the brain that has an inflammatory response, then you drive blood flow to that tissue because the nerves that are working, they're expending oxygen, and the body senses that instantly and starts pushing blood their direction and pushing oxygen their direction. So then you can do it a little bit more, and then you can do it a little bit more, and pretty soon your resilience increases. Neurologically, you get a greater sense of brain resilience in that case, right? So we could look at any one of the symptoms that are on the screen, and you say, okay, now I get that it makes a huge difference for me when I do those exercises because my resilience comes back and my brain starts working a little bit better.